Hello everyone, my name is Miriam and I'm going to be doing a discussion on how I'm going to give a difficult conversation with my patient who has diagnosed with lung cancer. So I'm going to do my introduction like a soap note. So I'm going to do a subjective. Miss W is 47-year-old African American female, presents with a 6-month history of non-productive cough, shortness of breath, weakness, and unintentional weight loss of approximately 30 pounds. She reports difficult eating due to shortness of breath and lack of appetite. Objective. So they did the chest x-ray, which showed the lung mass, and the CT scan, which showed the right lower lung mass, subclavian masses, adrenal mass, and liver metastasis. The biopsy showed a small cell lung cancer. And then the labs that they did, it showed like she had acute kidney injury. So an assessment, Ms. W has stage 4 small lung cancer with metastasis to the liver, adrenal gland, and subclavian region. She also has AKI and experiencing symptoms of shortness of breath, weakness, and unintentional weight loss. So the plan, I will discuss the prognosis and treatment option with Ms. W and her family. I will refer to oncology for chemotherapy and radiation. I will initiate palliative care for symptom management. I will address the AKI, which is acute kidney injury, with hydration and monitoring the renal function. I will encourage smoking cessation and a reduction of alcohol consumption. I will provide emotional support and guidance to Ms. W and her family. So the agenda, communication objective, I will assess the patient understanding of lung cancer and its causes. I will discuss prognosis and treatment option. I will develop a plan for immediate and long-term care. I will educate patient and family on medication, nursing intervention, and community support. So the communication agenda, I will assess the patient knowledge of lung cancer and its symptom and treatment option. I will discuss the possible causes of lung cancer, including smoking and environmental factors. Prognosis, I will discuss patient prognosis, including life expectancy and potential complication. Immediate care, I will develop a plan for managing symptoms, including pain, shortness of breath, and fatigue. Long-term care, I will discuss long-term care options, including hospice and palliative care. Medication and nursing intervention, I will educate the patient and the family on medication, nursing intervention, community support, and community support. I'll provide information on community resources, including support group and home care services. Family meeting and follow-up conversation. So I will schedule family meeting to discuss the patient care plan and answer the questions. Follow-up conversation will be scheduled to ensure patient and family understanding and address the concern and the questions. I will include interdisciplinary team, which is oncology team, to provide input on treatment option and prognosis. Palliative care team, provide input, symptom management and long-term care. Social work, to provide input on community resources and support. A nursing team, to provide input on medication, nursing intervention, and community support. So for preparing the physical setting, I will ensure conducive environment to effective communication, The physical setting for the conversation with Ms. W and her family member should be carefree and prepared. So the room selection, I will choose a quiet private room with limited access to minimize distraction and ensure the confidentiality. I will ensure the room is not near a common area with high foot traffic. I'll select a room with open window to provide a cool and comfortable environment. Setting arrangement. I'll ensure there is enough seat for all participants, including the healthcare team. I'll use identical seat to promote quality and avoid any perceived superiority. I will arrange the seat in a circular or semicircular configuration to facilitate open communication. Interruption and time management. So I will communicate the duration on the education session to all participants at the beginning of the meeting. I will establish no interruption policy to ensure respectful communication. I will also set the pace of the session to maintain focus and avoid unnecessary tangents. So I will introduce all of the attending healthcare provider to Ms. W and her family member before the session begins. I will clearly communicate the purpose and objective of the meeting. I will establish the ground rule for respectful communication, including active listening and no interruptions. So for involving the family or the patient and family healthcare providers, I will ensure to coordinate of communication of holistic care to involve the patient, significant other, family and relevant healthcare provider in the discussion. So I will identify the primary point of contact. I would identify the primary point of contact for the family and patient to facilitate its communication and ensure that the decisions are communicated effectively. At this point, contact person will help healthcare provider understand the patient and family's needs, preference, and values. So on the individualized communication, I will ensure that all the care decisions are communicated to the patient and family in a clear, concise, and individualized manner. I will provide written materials such as pamphlets or brochures to supplement oral communication, containing information about the condition, treatment plan, and contact information. I will involve interdisciplinary team, healthcare from different disciplines including oncology, palliative care, social work, and nursing should be involved in the decision to ensure holistic care. So the interdisciplinary team will work together to address the patient's physical, emotional, spiritual, and social needs. The team member will share their expertise and collaborate to develop comprehensive care plan that meets the patient's unique needs. On the collaboration and communication, so the interdisciplinary team will work together to ensure the patient receives quality care and is free of pain. Regular communication and collaboration among team members will facilitate the coordination of care and ensure that the patient needs are met. So on assessing patient's thoughts and needs, I will assess Ms. W thoughts and needs prior to initiating discussion about the end-of-life issue. I will employ a patient-centered approach considering her cultural beliefs, attitude toward death, and dignity. So the initial assessment, I will use open-ended questions to explore Ms. White's understanding of end-of-life care, such as, what do you know about the end of life? Or, what are your thoughts about hospice care? Clearly, I will clarify any misconception and build up her existing knowledge. So on education and support, I will provide education of end-of-life care, highlighting its benefits for patients with advanced illness, such as improved symptom management and enhanced quality of life. I will address any concern or fear Ms. W may have, taking into consideration her culture, beliefs, and values. I will respectfully honor her wishes regarding dignity and end-of-life care. So I will engage in active listening to understand Ms. W's concern, value, and preferences. I will acknowledge and validate her emotion, ensuring empathy and compassion. On cultural sensitivity, I will be sensitive to Ms. W's culture, belief, and value, avoiding assumption or stereotypes. Incorporate her cultural preferences in the care plan, ensuring respect and dignity. For family involvement in palliative care and hospice, as we know that the family involvement is crucial in palliative and hospice care, as they play a vital role in supporting the patient and making care decisions. To ensure effective family involvement, I should include, first of all, I have to get the consent from the patient. Obtain the patient's consent to involve family member in the discussion. Ensure that the patient understands that the family member will be given their health information. I'll discuss the treatment option with the family and with the patient and family member, ensuring that patient's autonomy and preferences are respected. I will address any withholding information. Like if a family member requests to withhold information from the patient, clarify that the patient has autonomy over their care and the right to access their diagnosis and condition of information. I'll prioritize the patient's preference and ensure respect for patient autonomy. For decision-making dynamics, I will identify the decision-making dynamic within the family. I'll determining who is the right person to discuss end-of-life issue with. And I will ensure that the patient wishes and preferences are respected and prioritized. So by respecting patient autonomy, I will respect the patient autonomy and decision making, ensuring that their preferences and value are honored. Prioritize patient-centered care, ensuring that the patient needs and concerns are addressed. To ensure that Ms. W and her family understand her diagnosis, treatment option, and involvement in decision making, I will provide information and explain medical facts in a clear, concise, and compassionate manner. Assessing patient prior the knowledge. Before I do all that, I explain the diagnosis. I will assess what Ms. W already know about her condition to determine where to begin the discussion. I will use the simple language. I will avoid using medical jargons or scientific terms that may be difficult for Ms. White and her family to understand. Instead, I will use the simple language that is easier to comprehend, ensuring that all information is clearly understood. I will provide a systematic explanation of the diagnosis, treatment option, and care plan using visual aid or a diagram if necessary. I will also provide written material or resources to supplement the discussion, facilitate further understanding. I will encourage Ms. W and her family to ask questions and seek clarification on any aspect of the diagnosis or a treatment plan that they do not understand. I will also provide opportunity for them to express their concern, values, and preferences. By showing understanding, respect, and support, to demonstrate this understanding, respect, and support to Ms. W and her family, I will employ the following strategies. 1. I will use open communication, which I will establish open communication with Ms. W and her family, encouraging them to express their concerns, fears, and value. I will actively listen to their perspective, ensuring that their ideas and preferences are incorporated in the care plan. For cultural and spiritual sensitivity, I'll take time to understand Ms. W culture and spiritual belief, value, and practices. I will respect and honor those beliefs, incorporating them into the care plan to ensure culturally sensitive care. For support and referral, I'll provide emotional support guidance to Ms. W and her family, addressing their physical, emotional, and spiritual needs. I will offer necessary referral to ensure that Ms. W receives quality care, including palliative care, hospice care, and social services. On therapeutic communication, I will upholding therapeutic communication principle, including empathy, genuineness, and non-judgmental attitude. I use verbal and non-verbal cues to convey compassion, understanding, and support. The benefit of hospice and palliative care. Hospice and palliative care provide comprehensive, patient-centered support to individuals with terminal illness, offering numerous benefits to both patients and their families. Palliative care and hospice care enable patients to live comfortably, coping with their illness and its symptoms. Its effective symptom management, including pain relief, improve patient overall quality of life. For emotional and psychological support, hospice and palliative care provide emotional and physical support to a patient with their families, helping them to cope with stress, anxiety associated with end-of-life care. And this support enables patients and families to navigate the complex emotional landscape of the terminal illness. Hospice and palliative care help the patient and the family process and cope with the trauma often experienced during the advanced stage of terminal illness. So about the comprehensive care, hospice and palliative care addresses the physical, emotional, social, and spiritual needs of the patient and their family, providing comprehensive and holistic support. Thank you.